Welcome to the Next Level podcast. So today we have a very special guest, Dr. Pam.
Hello.
Dr. Pam is our pelvic floor guru, and today's topic is going to be, surprise, surprise, pelvic floor. So, Dr. Pam, would you be able to introduce yourself?
Yeah. So I'm currently the only female therapist full-time on board at Next Level. I started basically treating all orthopedics at a PT school and have transitioned to treating both ortho and then concentrating a lot on pelvic floor PT. I did my undergrad at Johns Hopkins University and played soccer there, and then went to Rutgers for my doctoral degree in PT.
Awesome. So what in particular made you kind of interested in pelvic floor? Because it's very, it's kind of like a up and coming thing. I mean, obviously it's been in the realm of physical therapy for a long time, but in particular for you, what kind of drew you to that?
Well, everyone who knows Next Level knows Jerry Yu, the owner, and Jerry has this innate ability to get people to kind of step out of their comfort zone and do things that they didn't think they would be doing. So Jerry, just in conversation a couple years ago, was like, "Hey, what do you think about pelvic floor?" And I wasn't thinking about pelvic floor, but sure. So I ended up taking a class because all of the pelvic floor PT knowledge you don't get in school, you get after in all these continuing ed classes. So I ended up taking a 3-day intensive class learning about the pelvic floor, and it was eye-opening in the sense that I was like, why have I not known anything about this entire muscle group, having gone through just the world as a human being, as a female, and then in PT too, like we didn't touch upon it at all. So from there, I was like, this is important, and more people, if I don't know anything about it, chances are a lot of people are in the same boat.
So just to follow up on that for some of our watchers, what constitutes the pelvic floor?
Yeah, so actually I have a moderator. All right, so this is a good visual. So your pelvic floor is basically just a muscular group with 3 different layers on the bottom of your pelvis. So if you see the left and right bones here, and then your sit bones, the bones that we sit on, the pelvic floor is all this red musculature in between. So it kind of runs from your pubic bone to your tailbone and then side to side from those sit bones. What's cool about it is that it has so many different functions. So these muscles are both strength muscles and endurance muscles. So they help support all your organs just with the weight of, throughout the day, managing pressure. And then they also help in sphincter control. So the continence that we take for granted every day, if there's dysfunction in some of those muscles, then you could have incontinence with urinary incontinence or fecal incontinence. So these muscles are very, very important. If things go wrong with that, they're daily functions. So it's not just about running a marathon. These are functional things.
So, I mean, I think that a lot of people associate pelvic floor health with women's health, and like for a long time it was called women's health when we're referring to it. Can you just talk a little bit about the different areas in which and different people that would benefit from?
Yeah, absolutely. So I feel like when females go through pregnancy, this whole system gets directly disrupted. So that's why there's that basic connection to treating either postpartum women or then if women thereafter have symptoms directly from the pregnancy, including those incontinence symptoms, that's kind of a big realm of pelvic floor, but everyone has these muscles. So Dr. Dave, you have a pelvic floor. Alex, you have a pelvic floor too. We have different organs above the pelvic floor, right, that differentiate between males and females, but it's just like anything else in your body. And if we know a little bit more and are educated on proper breathing systems, your pelvic floor relaxes and contracts all the time just with the proper breath. So if we're not getting that, then we're setting ourselves up for dysfunction in that sense. I actually treat a lot of males. I would say more at this moment, my caseload has more male pelvic floor patients than even female pelvic floor patients. Very common prostate surgery, dysfunctions with the sphincters with that. But your pelvic floor is just another missing piece of this puzzle that we shouldn't ignore. So even orthopedic patients that I see, I'm just treating orthopedic plus pelvic floor, not always just pelvic floor symptoms.
Yeah.
And so what kind of issues would you might be experiencing that would lead you to pelvic floor dysfunction? So I know a lot of athletes, when they're exerting or either jumping or running or something like that, they may experience, some very minor incontinence. Is that normal?
Yeah, so the big thing that we learn in all these pelvic floor classes are that these symptoms are very common, but it's not normal. So I'll have patients come in and just talk about, and it's a sensitive subject, right? If you're talking about, incontinence or pain with sex, or these are intimate topics that not everyone wants to just disclose on the initial visit, but there's a human tendency to kind of be like, oh, well, I don't have that, but I just have this. So like people will say, I would talk about, any symptoms of incontinence, and people say, no, just after I have kids. Yeah, I pee a little. And then you're like, oh, like, when did you have kids? And it's 20 years ago, so.
It's like, that's also incontinence.
Right. But I got you. I hear you. So, so the thing with pelvic floor PT is it's never too late, right? So, if you have had incontinence for 20 years, or if you just gave birth a couple months ago, these symptoms don't just come with pregnancy, right? So your pelvic floor is disrupted. Your whole body has gone through probably the biggest thing it's ever gone through, but that doesn't mean that incontinence just comes with it, right? So there is dysfunction that we can address. And I've had patients who have had this incontinence for that 20-year period and have gotten better through pelvic floor PT.
Gotcha. So what are so we talked about a little bit of incontinence, and we talked about other things. What are some signs for the people listening that they might benefit from pelvic floor PT?
Yeah, so unfortunately, it's not something that's like just our go-to these days. So I think in France, after every single woman gives birth, you go see a pelvic floor PT. It's just the norm. So we don't have that in the US yet, but it should be, right? So after, say, if we take that pregnant person who's giving birth, they should go see a pelvic floor PT to see were there tears during delivery, right? Like if you tear your hamstring and you would never just not go to get that addressed, and women just do for some reason. So postpartum is definitely a big population. Everyone should have checked on diastasis recti, that separation of their abdominal muscles, or prolapse. But these things don't just occur in these pelvic floor symptoms don't just occur in postpartum patients.
So you would suggest that everyone that had a baby
for sure
get checked out for pelvic floor dysfunction.
For sure. And then just forget the postpartum population, just people in general, right? So this is these muscles attach onto your sacrum, onto your hip bone. So they have a direct attachment to where your groin attaches. So orthopedic conditions like groin pain or hip pain or low back pain, they're directly related to what's going on with your pelvic floor. So it's a huge component that even just orthopedic issues can be connected to. And then if you have no symptoms at all and you're good, we still need to know this like important part of our body. So education is the biggest thing. And then once you kind of learn how you're breathing properly and check all those things out, then you can apply these principles through every exercise. I don't do an exercise now where I'm not thinking of my rib cage alignment, my pelvis alignment, and what's going on with my pelvic floor.
Yeah, I know. I think what people think about when they think pelvic floor or women's health, they immediately think about like Kegels and different versions of Kegels, and that's kind of what the purveying thought is. Can you speak to how that is kind of not what is?
Yes. So even still to this day, I'll have patients walk in who either had prostate surgery or they have incontinence, and they're like mind blown that they're like, I've been doing Kegels. I've been doing, 20 Kegels every 10 minutes. And like, Okay, so a Kegel is just a pelvic floor muscle contraction, right? But the problem is a lot of times these muscles might not just be weak, they also hold a lot of tension. So I see more often than not that the pelvic floor and the people I treat, the problem comes from just a disconnect in the system and poor coordination. And a lot of times these muscles are tight, so they need to be released, whether that's through internal work or proper breathing or position, before you can gain the strength. But it's a hypertonicity problem. It's more of a tightness problem than a weakness problem directly. So people just doing Kegels will only reinforce that issue. And then the other thing is most people aren't even doing Kegels correctly.
Yeah.
So they're either compensating or they're bearing down, and that's just putting pressure through the pelvic floor and going to contribute more to prolapse or incontinence or whatever symptoms they're having.
And I think when we spoke about it a few months back, and it really made sense when you think about, like, you wouldn't start to overly exercise a muscle that's already dysfunctional.
Yeah.
Right.
Exactly.
So it's like, if you have some sort of pelvic floor dysfunction, then all you're doing are Kegels in order to fix it. You're probably just exacerbating the issue. Just like, you pull your hamstring, you're not going to start doing hamstring curls all day.
Yeah, that's not the first step. And especially with this black box of a muscle that we don't really know a lot about, like even myself going through these classes, I hold tension, and this is one of the biggest muscles that I like people hold tension in. I didn't realize I was like clenching my pelvic floor all day long. So if you think about that, if you think about like, your bicep, if you're just holding like this all day long, that's going to fatigue out, right? So then you expect it to be able to keep you continent or hold the weight. It's going to fatigue when that comes. So awareness of what your pelvic floor is, what it feels like, if you're holding tension, if you're bearing down, that's the first step before you add anything else onto it.
And just for the people watching, what are some healthy practices that one could do for the pelvic floor? And I think you've already kind of mentioned a few of those, which are like not bearing down. Can you speak about that?
Yeah. So a lot of it too will just I'm looking at the whole body when I'm assessing for pelvic floor. So yeah, we can look directly at the pelvic floor to see whether, there's trigger points or that sort of thing. But I'm looking at posture. If your pelvis is out of alignment, then that's going to put the muscle in a bad position, in a shortened position. So I want to watch for that. I want to see how people are moving. And then like anything, this is just a piece of the puzzle, but pelvic floor issues, much like other issues, are like a full body issue, right? So a lot of times it could even just be something as simple as people are not drinking enough water, right? So I've had patients with incontinence, and it makes sense if you think, oh, every time I drink water or I have leakage with this, maybe let's just not drink as much water, right? But that actually is going to just contribute to more symptoms, right? So you need to be getting enough fiber, drinking enough water, in proper mechanics. When you go to the bathroom, I've talked about the squatty potty before, but that's a very easy, useful thing for pelvic health.
So you recommend the squatty potty?
I do recommend the squatty potty. Yes, I have one myself. Even if you have no issues at all using the bathroom, it just puts your muscles in a better position, so you avoid straining. You might not even realize you're increasing your pressure or bearing down, but a lot of the exercises you're speaking to are more kind of pressure management, right? So people, if you think about your core as a rectangle, so you have like your abs in the front, your back, your low back, and those stabilizing muscles. Your pelvic floor is just the bottom, and then your diaphragm's the top. In that system, if pressure isn't being managed properly, say your back is very tight or you get no side rib expansion, that's just going to go all the way down through your pelvic floor. So we like to use a lot of just breathing exercises and start with that. That's going to help you the most.
So that concept is like, if you have tightness in certain areas and you're not expanding in other areas, when you think about that black box, pressure has to go somewhere. Just like you squeeze a balloon, the pressure has to either come out between the fingers or out the sides. If you're squeezing a balloon but certain areas are not expanding, all that just goes down.
Exactly. So if we take that postpartum patient, right, who has vulnerability in that pelvic floor system, and through pregnancy, I could attest to your back getting tight, your ribs getting tight. So when you need it most, you're unable to expand in those areas. So your pressure is going to go through the path of least resistance, right? So in that sense, it'll be your pelvic floor. So you might be more likely to get prolapse symptoms there. Or also, think about how much your abs have to stretch just to hold the baby, right? So that's a path of least resistance too. A lot of people, just in general, breathe through their front. So if you're thinking about that rectangle, people will do yoga or diaphragmatic breathing, and we want that diaphragm to be the breath that we're using, but that doesn't just mean belly breathing. So it doesn't just mean breathe through your diaphragm. Okay, I'm going to push out through my belly. I'm not going to shrug and use my accessory muscles. It should be a proper system of an elevator.
Expansion, 360 degrees.
Exactly. So you want that piston being able to descend, and that breath going through your ribcage, through your back, into your pelvic floor for a nice expansion and length, but not too much pressure where you're just increasing pressure on your muscles that don't need it.
Gotcha. So just to recap, people that probably need pelvic floor PT, anyone that has given birth recently.
Yes.
Anyone that's having some sort of incontinence issue.
Yep.
Or prolapse issue.
Right. So if you've peed yourself at all, that's not a normal thing. So don't confuse that for being normal. There are things that we could do to help that.
Gotcha.
And it sounds like the demographic expands to so many people. Just the tightness. I mean, the postpartum, the regular endurance athlete, those power lifters that use weight belts all the time. The demographic goes on and on.
Yeah. Exactly. Whether it's a high power athlete or as a runner, if we're just thinking about this basic unit as a pressure system, they have to increase their pressure to hold that 300-pound squat or whatever they're doing. That pressure doesn't just not go through your pelvic floor, right? It's going through your whole system. So even if you don't have symptoms, or if you did, and if you learn how to manage that and brace properly, you're going to be so much better off. You can't just ignore a major part of your body. So it's important for everybody.
Awesome. So thank you so much, Pam. It was really, really informative. Everyone that's watching out there, if you heard any of those symptoms or you just gave birth, give us a call and we'll be here for you. All right? Have a good day.
Thank you.
Bye, guys.